Syphilis. What is syphilis? Syphilis is a sexually transmitted infection or disease. So you get it sexually, but you also get it through kissing. It's not just through sex, like oral sex, anal sex, vaginal sex, okay? You can also get it through kissing. It is an infection by the Treponema pallidum bacteria, okay? So it's a bacterial infection. So you will be treated with an antibiotic, ne? You will be treated with an antibiotic. That is what syphilis is. Syphilis is divided into many stages, but I will use my own shortcut. There is early syphilis and late syphilis. Okay, 2. With early, we have 2 types. We have primary syphilis and we have secondary syphilis. Primary syphilis, you might not know that you even have syphilis in primary syphilis. Even when you test, you might even test negative because it's in the very early stages of the infection. It takes about 4 to 6 weeks for an RPR test to become positive when someone is infected with syphilis. Primary syphilis. In primary syphilis, most people, they get an ulcer, a round or circular ulcer that is in their genitals. It can be in the foreskin, can be in the glands of the penis, it can be in the vulva, it can be in the labia of the genitalia of a female, it can be in the anal area, it can be in the cervix of the woman, right up there inside the vagina that we can see with the speculum examination. If it was through kissing, it can be inside the mouth, in the tongue, or in the buccal mucosa, inside the cheeks. So it can be anywhere where the bacteria got in contact with your skin. That's primary syphilis. We call it, or it is called, a chancre. Okay? That's primary syphilis. And then we have secondary. So primary syphilis, you might not know. Oh, one thing I forgot. A chancre is actually painless. So some people, they are not even aware that they have the sore or lesion on their body. They are not aware. That's primary syphilis. And then we have secondary syphilis under early syphilis. We have secondary syphilis. Secondary syphilis, the test will definitely test positive. Okay. Most people that come in, they have a rash in their body. It's rare for it to be on the face. They have it on their scalp. They might be hair loss, on the body, on the trunk, on the torso, on the arms, on their genitalia, or on the legs. They basically have a rash. This rash, it's like round spots, macules. It's like round, sometimes raised round spots. They look red or maroonish most of the time, not always, most of the time. And they are not itchy most of the time. Okay, they are not itchy. So the person will come in and they will say, I have this rash, sister, I have a rash on my tummy. And when you look at it, because you know already the symptoms of secondary syphilis, and then you just know, you do the test and it becomes positive, and then they get treated. So that is early syphilis, which is 2. It is primary and secondary. And then we have late syphilis. Late syphilis, the person is asymptomatic. They don't have symptoms. They don't even know they have syphilis. They are carrying it around. They are giving it to one person to another, depending on how many partners they have. Hopefully it's one partner, because if it's multiple partners, then they are giving it to all the multiple partners. That's late syphilis. Now, early syphilis. How do we treat? Okay, how do you get syphilis? You get syphilis through sexual intercourse, anal sex, vaginal sex, oral sex, kissing, okay, mucosal membranes, kissing, through all those routes, and you did not use a condom. Okay, I will not say you did not use protection. I will say you did not use a condom, because when you say you did not use protection, even PrEP is protection. Okay, someone can be on PrEP for HIV prevention and they say that, but they are on protection. So without using a condom. All right, now treatment. The treatment is for you and your partner or your partners. Okay, if you have multiple partners, they all have to be treated. For early syphilis, meaning if you come and you have that chancre, okay, you have a sore, that's early syphilis, or primary, that, and then secondary, you have that rash that is on your, it can be anywhere on your body, but it's rarely on your face. You get bicillin injection once, stat. Or you get doxycycline for 14 days. For late syphilis, you get bicillin injection, which is a penicillin injection. You get it every week for 3 weeks. Or you get doxycycline for 28 days. Now, with syphilis, it's important that the bloods are taken, because you want to know the titer or the titer. Okay? Because if someone gets infected with syphilis, their antibodies might always be positive, but you need to look at the titer. Okay, if there is a 4-fold decrease, it means that their previous treatment worked. Okay, so we as nurses, sexual health practitioners, and doctors know how to interpret your lab results. Okay, so it's important when you get diagnosed with syphilis, it's important that bloods are taken, okay, to know the titer, so that in case you come back again and you have an ulcer or you have symptoms or you test again positive, then we draw the bloods and then we compare the bloods. Okay, now the third syphilis I didn't mention is congenital syphilis. This is the syphilis that a pregnant lady, mother, gives to her child if she is not treated. This mostly happens to unbooked mothers. These are mothers who don't go to the clinic or to the doctor when they are pregnant. They just come when they are in labor to deliver the baby. And then you find that there's this and there's that, and then there's syphilis, and then there's that. Now the baby has syphilis, the mother has syphilis, da. You see, it's a crisis. That is not nice. That we don't like. We don't like it as healthcare practitioners, because it's always complicated. And usually congenital syphilis affects the child's neurodevelopment. So it's not nice. Usually it can be detected. I had a case recently of a mother who had a miscarriage at 8 months, and it was discovered that she actually had syphilis. She didn't know. And I will be honest, the male partner confessed that while the female partner was away, she was still pregnant, but apparently she was away for a while. The male partner got someone. And then the female partner who's pregnant came back. And obviously, the male partner then got it from that one, that side partner, and then gave it to the pregnant female partner. So they unfortunately lost that baby. So with congenital syphilis, it can cause stillbirth. The child can be fully formed but born not alive. It can cause miscarriages after 4 months, but in any duration of the pregnancy, but from the 4 months onwards, it can cause stillbirth. It can cause a baby to be born macerated. Macerated is like the skin is like peeling, not peeling off, but it's like, yeah, just Google macerated. It's MACERATED. Or the baby can be born and the baby can be given bisalin. I'm not sure now. I think it's 300,000 units. The baby can be given bisalin, but there can be signs and symptoms of brain problems in that child and other problems. So that is syphilis, guys. If you have any questions, let me see if I missed anything. Yeah, very important. The partners have to be treated as well, please. The partners have to be treated as well. If you go to the clinic or to the doctor, they must write down exactly the diagnosis that you had. They must give you a note. You must give it to your partner. Your partner must take that note to the doctor wherever they are. Take a photo, show them, and they must take it to their nearest clinic or private doctor or hospital or whatever institution is available for treatment as well. And lastly, if you do want to do a syphilis test and many other actually STI tests, I do have a Linktree link on my profile. I do have STD tests that you can buy, so you can just click on that link. It's a Linktree JJ Amani link. You can just click on it. It will show you all the available STD tests. If you are struggling, let me know. Send me a message, send me a WhatsApp. I will assist you, and then you can get yourself tested at home, even with your partner, easily. So let's get tested. Let's get tested, good people. Let's get tested regularly. Let's get tested. All right, until later. So that was syphilis. Okay, it's also one of sexually transmitted infections.